Good morning. Thank you all for participating in today's media briefing, our 34th since the start of the pandemic. We continue to hold these briefings as part of UPMC's ongoing commitment to provide timely and accurate information. Today, I'm joined by Dr. Erin McCreary, Director of Antimicrobial Stewardship Innovation and Infectious Diseases at UPMC, Dr. Graham Snyder, Medical Director of Infection Prevention and Hospital Epidemiology at UPMC, and Dr. Don Yealy, UPMC's Chief Medical Officer. They will share the latest findings from UPMC's ongoing Learning While Doing COVID-19 trials and provide an update on our continued preparedness to treat COVID-19 patients and all patients at our hospitals and facilities. After the remarks, we will take your questions. Dr. McCreary.
Thank you, and good morning, afternoon. COVID-19 cases are climbing across all of the communities that UPMC serves. The more cases we have in the community, the more severe cases that we're going to see. Currently, we have the highest number of hospitalized COVID-19 patients that we've seen since this time last winter. However, we are much better positioned to help patients avoid hospitalization and death. First, everyone should complete a COVID-19 vaccination series as soon as possible, as vaccination continues to be the safest and most effective way to protect yourself and your loved ones from COVID-19. There is no time to wait as we head into what we anticipate will be a difficult winter, so please get vaccinated. Second, if you have mild symptoms of COVID-19, even as simple as a cough or a sneeze, you should get tested as soon as possible, and if you qualify, you should seek monoclonal antibody therapy. Today, we are sharing our results from UPMC patients that could help other healthcare providers caring for those with COVID-19 and reduce the number of hospitalizations and deaths that we see this winter. UPMC performed the first and largest clinical trial in the world to compare different methods of administering Regeneron's casirivimab and imdevimab monoclonal antibody combination product. We found that giving this treatment to outpatients with mild to moderate COVID-19 via injections under the skin or subcutaneously is essentially as effective as giving it through an IV, and it's far superior to not receiving monoclonal antibody treatment at all. This is very important because injections given under the skin can be given over less time and are much easier to administer than IV infusions. With this in mind, we can more than double the number of patients that we treat this way, helping ensure that we are treating as many patients as possible and saving as many lives as possible. So monoclonal antibodies are a one-time treatment that are authorized for people with mild to moderate COVID-19 and certain characteristics such as pregnancy, advanced age, compromised immune systems, or chronic health conditions that might put you at risk of more severe disease. For the best outcome, monoclonal antibodies should be administered as soon as possible after you learn that you have COVID-19. This is why we encourage testing as soon as possible, again, even for mild symptoms, and if you are positive, referral for monoclonal antibodies as soon as possible. Several pharmaceutical companies currently make monoclonal antibody treatments. The FDA has authorized one of those treatments, again, the Regeneron, casirivimab, and imdevimab product, to be given subcutaneously or under the skin as an injection when an IV infusion is not feasible or giving an IV infusion would lead to a delay in treatment. But there's been no randomized clinical trials previously looking at these under-the-skin injections to see if they worked as well as IV for treatment of COVID-19. So as an academic medical center and a learning health system, where we service patients across most of Pennsylvania, as well as New York, Maryland, Ohio, West Virginia, and even beyond, UPMC was uniquely positioned to answer that very question. So when our communities experienced a surge in COVID-19 patient cases, we switched most of our outpatient infusion centers to administering these monoclonal antibodies by injections under the skin to ensure that we could treat as many patients as possible. We followed over 2,000 patients who received monoclonal antibodies, either by this under-the-skin injection or by IV infusion, for 28 days, and we compared them to a population of patients who had these high-risk criteria for disease, but they did not receive antibody treatment. What we found is that subcutaneous injections of Regeneron's COVID-19 treatment worked essentially as effectively as the IV at keeping our patients alive and out of the hospital. And the subcutaneous injections were associated with a nearly 60% lower chance of being hospitalized or dying compared to patients who did not get treatment. So in short, if you think you have COVID-19, again, get tested promptly, and if you are positive, ask if you are eligible for monoclonal antibody therapy. You can find out if you qualify by visiting upmc.com/antibody treatment or by calling 866-804-5251. And to my fellow healthcare providers in the community, please consider offering subcutaneous injections of casirivimab and imdevimab. This could greatly expand available locations for patients to receive treatment, as it's much easier to give and there are more staff available to give this than with the IV infusions. Our clinical research shows that these subcutaneous injections are an effective solution and that it helps save lives.
Thank you, Dr. McCreary. This is great news. It was UPMC's ongoing learning while doing research that led to this discovery. And I'm pleased to share that we're already working to answer the next question. Do monoclonal antibodies, vaccines, or other treatments work against Omicron, the latest SARS-CoV-2 variant of concern? It's not surprising that we're seeing the emergence of another variant. A virus can survive only by copying itself inside our body, which it does billions of times. Sometimes a copy of the virus has a mistake, a mutation. When one or more mutations makes the virus more successful, that new variant of the virus will spread. A new variant may be more successful because it changes how we get sick, is easier to pass person to person, or is not as well controlled by our immune system or the therapies that we have, or a combination of these factors. As long as the virus is spreading around the world, there will be an opportunity for a new, potentially more dangerous variant. Preventing virus spread by masking, distancing, getting vaccinated, and staying home if sick is how we stay safe from new variants. Because of UPMC and Pitt's robust COVID-19 testing and our ongoing adaptive clinical studies, we can move fast to provide guidance on Omicron. We performed genomic sequencing on a sampling of SARS-CoV-2 viruses from our community, giving us an understanding of the variants circulating in our region. Our data analytics team has tracked COVID-19 trends with each surge and each variant, and will continue to do that when Omicron arrives in our region. We can use the strength of our robust healthcare databases to know who is most vulnerable to infection and complications and how well treatments work. We will be among the first in the United States to analyze the effectiveness of monoclonal antibodies against Omicron. Finally, to assess how well the vaccination and vaccine boosters protect our healthcare workers against Omicron, we will continue to closely track breakthrough infections among our vaccinated healthcare workers. There is a lot we have yet to learn about Omicron, including who's most likely to get sick, what are the patterns of illness it causes, how effectively and rapidly it spreads, and how well prepared we remain through vaccines and treatments like monoclonal antibodies. As UPMC contributes answers to these questions, we know that Omicron, like Delta before it, will not change what we need to do to stay safe. Wear masks. This not only protects against the spread of COVID-19, but also influenza, which is rapidly emerging in our communities, and other respiratory viruses. Get vaccinated. It's very likely that the current vaccines will continue to offer protection against Omicron. Boosters are recommended for all adults and can ensure your immune system remains prepared. And get your flu shot, which you can get at the same time as your COVID-19 vaccination. Every year, influenza leads to hospitalizations and deaths. And even though last year was a little different, this year will not be an exception to that. If you're feeling ill, get tested for COVID-19 and stay home. If you test positive for COVID-19, even if you don't feel seriously ill or are vaccinated, consider monoclonal antibody treatment. As Dr. McCreary noted, it's important to take this life-saving treatment early.
Thank you, Dr. Snyder. The safety measures that you mentioned not only keep each one of us safe if we apply them, but they keep those all around you safe. That means your family, your coworkers, our healthcare workers and employees, and everyone in the community. We want to be there and work tirelessly, as we've been doing, to be ready for you when you need us. Healthcare workers around the globe and here at UPMC have dedicated their lives to caring for those with COVID-19 and with any other illness for the past 22 months. While it hasn't always been easy, I'm proud and honored to work with our medical, nursing, and ancillary staff and everyone who is part of the team at UPMC. They show dedication, resilience, and resolve day in and day out. Right now, our biggest challenge, and it is a very big one, is hospital capacity. Our COVID-19 inpatient volume is climbing, as you heard from Dr. McCreary, but so are visits for other important health issues. A nationwide staffing shortage makes the situation even more challenging. Seasonal flu cases are rapidly climbing, signaling that our busy emergency departments may become even more crowded by these coinciding contagions. We're determined to provide the right care for you at the right time. We want to do the best for the most people. We have deployed advanced ways to provide care for people. That includes care in the hospital and care outside of the hospital setting. We know that many people want to recover at home and often recover better there or at another facility aside from a hospital. We will engage all of those opportunities. We're focused on being as efficient and as effective as possible. We want to provide every minute of care that you need in a hospital, but not a minute longer. We are aggressively changing how we recruit, retain, and advance our employees. Our people are UPMC. Our staff is what sets us apart. My plea to you during this holiday season is that everyone who is eligible for COVID-19 and a flu vaccine make the choice to get one. That, plus masking when you're indoors or in crowds with those who are not in your immediate family, are the best protection from COVID-19 and flu. If you get sick, stay home and get tested. That allows us to help you better. If you're unvaccinated, please reach out to us. We can talk to you about your concerns. You can come to one of our vaccination clinics, even if you don't want to be vaccinated that day, and our experts will respectfully answer any of your questions. I believe that we can all have a healthy and happy holiday season by working together, taking care of each other, and being diligent, taking these simple actions that we know are effective in protecting us against COVID-19.
Thank you all. And now we'll take questions from the media. To ask a question, please go to the participants icon at the bottom of the page and press the raise your hand button. That will put you in the queue. I will read your name and will unmute you. We'll unmute your line for you. Please remember to unmute your line on your end as well. We'll try to call on as many different media outlets as we can in the time that we have allotted. So again, go to the participants icon at the bottom of the page, press the raise your hand button. That'll put you in the queue, and we will go from there. First question is an email to us. There were a number of court orders issued. There was a court order issued this week blocking federal vaccination mandates. Dr. Ely, what is UPMC's plan going forward?
Well, we are closely watching the courts as the federal vaccine mandates are being considered. UPMC will comply with whatever is finally decided by the courts and the government. A cornerstone to good health care is very simple, and it boils down to one thing: caring and thoughtful dialogue. This goes for our patients when they're considering a procedure or weighing their medical options, and it also goes for our employees. Right now, we are focused on educating and encouraging everyone, our community members as well as those who work with us and for us, to get vaccinated. We believe everyone eligible should get a vaccine. They are safe, they're effective, and they continue to be a crucial layer of protection against severe illness caused by COVID-19.
Okay, thank you, Dr. Yili. First question will be Chandy Chapman from WTAE TV. Chandy, please go ahead.
Yes, thanks for taking my question. It's a two-part question. Is one vaccine brand better than the other in protection from these variants, specifically the Omicron variant? And what advice would you give to people who have children who can't be vaccinated when it comes to transmission of the virus and the variants, even if they're vaccinated? With the holidays coming up, a lot of people are going to be gathering of all ages. So I just had those two questions.
Dr. Snyder.
Let's talk first about the vaccines. All three vaccines available in the United States, the Moderna vaccine, Pfizer vaccine, and Johnson & Johnson vaccine, are fantastic. They're all safe, and they're all highly effective. We are seeing different vaccine schedules emerge. So the number of doses and the timing of booster is a little different for each of them. And that's so that you get the maximum benefit to your immune system from those vaccines. We do not yet know what impact these vaccines will have against the Omicron variant. I do not suspect that they'll have no impact. They will be effective against Omicron. The question is, will they be as effective as they currently are against Delta, or will we see some small or modest drop in the effectiveness? Already, vaccine manufacturers have been telling us about the potential for Omicron-specific boosters, but I want to encourage people, if you're not yet vaccinated, get vaccinated now. It's important for the virus that's circulating in the United States right now. And if you're eligible for a booster, get that booster because the booster doses of the vaccine both strengthen your immune response and strengthen the breadth of antibody response that you have. That's a good way to be prepared for Omicron. Now, not everybody in our community is eligible to get a vaccine, particularly young kids. Young kids are susceptible to COVID-19, and while we don't know yet whether or not Omicron will affect younger members of our community or older members of our community different, it will most certainly be able to cause similar effects throughout our community. We need to protect our kids who can't be vaccinated who can't be protected by vaccination. The best way to do this is to mask, if they're old enough to mask. That protects people from both spreading the virus and being exposed to the virus. To get vaccinated for the loved ones around those kids, so everybody else in the family should get vaccinated if they're eligible to be vaccinated, and get your boosters. And be conscientious, particularly around the holiday season, about the social gatherings you're in. Try to keep them small. Keep them to your household if you can. And if you are having a social gathering with a larger group of people, try to mask and consider distancing.
Let me emphasize 2 points. People often wonder about the primary vaccination or with the booster, which is better. The bigger question is, why don't I avail myself to either one of those things? Get a vaccine and get your booster. The differences are far smaller than protecting yourself with a vaccine. And secondly, if you want to protect someone in your family who's either vulnerable because they're young or they're older or they have an underlying condition, do all the other simple things. Get vaccinated, wear your mask when you're with others and in crowds. That still is the best way to keep even those who are more vulnerable from getting sick.
Great, thank you. Let's go to Sarah Bowden, WESA. Sarah, please go ahead.
Hi, thanks so much for taking my question this morning. This question is for Dr. Yili. On November 11th, you and the other chief medical officers in Southwest Pennsylvania issued a collective letter where you said you would fully comply with the new CMS rule that was recently, put on hold due to federal court rulings that are working their way through the federal system. And in that letter, you said, along with other chief medical officers, our health care teams need to serve all, and that we want our communities to be safer and healthier. So I guess my question is, are you going to not kind of wait until you see what happens with the CMS rule? And is that mandate for healthcare workers on hold? And, are you going to, if the court system says, no, you don't have to go through this mandate, will you not go through with the rule for UPMC workers to get vaccinated?
I missed some of your question, but I think what you're asking is, what's UPMC's approach to the vaccine going to be as we await the final adjudication with vaccine mandates that come from the government. UPMC believes that vaccines are an important part of the layers of protection and keeping everyone, whether you work for us, you come to us for care, as safe as possible. They do a very good job of preventing serious illness. They're not the only tool. We will comply with whatever mandate comes to us after both governmental and court involvement, and we will continue what has been our basic approach. Educate, inform, make vaccines easy and available, and engage with everyone, including our healthcare workers, about the opportunity to get this protection. Nothing about our approach has wavered with that. It hasn't changed with or without a mandate. So our approach continues. We've had increasing vaccination uptake, even over the past few weeks before a mandate became fully effective, and we will continue the same efforts. We believe in vaccination.
Quick follow-up then, is that to say that if the court says no, the government can't mandate healthcare workers to be vaccinated, then does that mean that you won't require staff to be vaccinated, even though you know it's the safest way to prevent the spread of COVID?
We will comply with whatever mandate exists, and we will continue our activities that encourage and try to increase vaccination. I can't say it any more directly than that.
Thank you, Dr. Ely. We have an email question from Dennis Thompson of Health Day. Why have the monoclonal antibodies been administered by IV rather than injection up to now? What were the perceived benefits of that approach? And also, do people getting an injection get the same dose as IV patients? Dr. McCreary?
Yes. So when these drugs are studied, they're studied in randomized clinical trials, and all of the companies were looking at these both as treatment of COVID-19, so patients with confirmed disease, and then as prevention of COVID-19, something we call post-exposure prophylaxis. All of the trials looking at treatment only studied the drug using it IV, so through the vein. The perceived benefit of that approach is that you give the drug directly into the patient's bloodstream, so you skip any need to get that drug, what we call absorbed, or basically moved from the skin or the stomach into the bloodstream. And so you're giving it directly, and it may act faster, and you ensure that the whole dose gets into the bloodstream to have an impact. In these post-exposure prophylaxis trials, they were studying it subcutaneously because of all the benefits we discussed, in that it's easier to administer, more staff can administer it, it takes less time, and these patients didn't have confirmed disease, and so they studied that approach there. When the government issued the emergency use authorization for treatment, they said IV is preferred because that's the data we had for treatment, but that if you were going to lead to delays or if you ran into these kinds of capacity situations, that you could consider subcutaneous administration. And so that is why we used that language to support our decision to switch to subcutaneous. But no systems and no studies and no companies had really evaluated if subcutaneous was as good as IV for treatment. And so that's what we looked at. And we're really thrilled with the results, because this is really so important for our communities that we have more options for treatment and we can expand access to care. The dose is the same, whether you give it sub-Q, under the skin, or through the vein.
Thank you, Dr. McCreary. Next question, Bill Kibler, the Altoona Mirror. Bill, please go ahead.
Thank you. I'm not sure how well this is going to go over, but I'll ask it anyway. At a meeting of Altoona City Council last night, a councilman said that a relative of his was told when he or she visited the UPMC Altoona ER this week that the wait would be 56 hours, which seems kind of unbelievable. I haven't heard anything otherwise anywhere close to that, but we have heard many times over the recent 6 weeks or so that there are very long waits, including for people who have serious issues, like a person with a heart attack, for example. I was wondering if any on the panel can comment on the situation at UPMC Altoona ER and say why it exists and what the hospital is trying to do about it.
Dr. Ely?
Well, thanks very much for that question. As we've talked about, demand for healthcare services and healthcare has grown dramatically over the past few months, and that includes services for people who have COVID-19 or think they might have COVID-19, and for all other types of illnesses and injuries. And coupling that with some of the other demands on the healthcare system, particularly workers, we've talked about it. It's been 22 months of continuous activity. We have many workers who've moved on to other types of activities. Makes this a volatile period of time. We have responded to that by making sure, A, that we're open and available for you at any time that you need care. B, that we create many different types of platforms for you to get that unscheduled care in addition to the emergency department, so you can get what you need in a format that works for you best. And then C, making sure that we use all of our assets, people, other facilities, to make sure we serve you as quickly and promptly as possible. Of course, there's longer waits now, given all of those dynamics. No one wants your care to be delayed. We don't want that. You don't want that. We work every day to monitor what those waits are. Are we prioritizing the most effectively so that those who wait actually can do so safely? And how is it that we can reduce that? We have been handling this. We will continue to handle it. It is not easy. This is a difficult challenge. We are well prepared. We have teams at UPMC Altoona that work each and every day to find those new solutions and invigorate the current solutions to make sure that the stories that you hear either don't ever happen again or never come true.
Thank you, Dr. Yearly. Next question, Shelley Bortz, or KDKA TV. Shelley, please go ahead.
Thank you for taking my question. Just quickly, I hear this statement all of the time. Eventually, COVID is going to find everyone. I just want you to expand on that, please, because that's a very scary statement.
Dr. Snyder.
Yeah, here's what we know about COVID around the world. It has reached all corners of the world. And with as much person-to-person exchange of the virus that's still happening, and with the rate of evolution that we've seen, we can expect this virus to be with us for some time. We'll probably be talking about it for at least years. Now, whether it becomes something that we can partly control and minimize the amount of disease it causes, or whether it becomes something that's part of our natural respiratory virus ecology, like influenza and other viruses, remains to be determined. I think what we should learn from the new variant emerging is exactly what's happening right now. The public health infrastructure around the world is important. We've learned very good lessons so far from the South African public health infrastructure doing a fantastic job learning and disseminating information quickly, and then do exactly what we're doing here at UPMC, which is learn quickly about the variant and adapt our protections. Some things are going to remain the same, like the effect of masking and distancing in preventing transmission. I do expect that we should plan for the foreseeable future, the next years, to be handling COVID as part of our lives.
Thank you, Doctor. Let's go to Mick Stinelli at the Pittsburgh Post-Gazette. Mick, please go ahead.
Hi, good morning. I was wondering in regards to capacity of the hospitals increasing, as was mentioned before, what exactly is the level of capacity across the UPMC healthcare system in the hospitals, and which locations are seeing the most strain from this influx of patients?
Dr. Ely.
Well, the demand for healthcare across all of the communities that we serve at UPMC is high. And so there's virtually no facility in our system that isn't operating near its high end of capacity. That's not new for us. We've been adapting to that for a long period of time. We will continue to always evolve and respond. We will be open. We will be there for you when you need it. There is no part of our healthcare system or our communities that's been spared. I don't expect that to change anytime in the very near future. The challenge for us is to make sure that we have healthcare available to you in as many different formats that work, and that we keep our staff as available, as healthy, and at the highest level to make sure that we're meeting your needs. We've been able to do that so far. It's a challenge. It's hard work right now. We're up to that challenge, and I'm comfortable that we'll continue on that pathway.
Thank you, Doctor. Next question, Samantha York, WHP TV in Harrisburg. Samantha, please go ahead. Samantha, please unmute your microphone.
There we go. Thank you for taking my question. I just wanted to ask if you could put some context to the COVID cases and surging that we're seeing right now. You know, how many cases we may have currently compared to a few weeks to a month ago, and also compare it to what we were looking at this time last year with the holiday season, since I know that was a difficult time in the pandemic.
We've known from the start of the pandemic that there will be ups and downs, and that these ups and downs may vary globally, nationally, and even regionally, and that remains true. So right now in the United States, with Delta variant comprising 99.9% of the virus that's circulating, we see some areas that are heavily impacted and some areas that are not as heavily impacted. Generally speaking, right now, we're seeing a pretty high level of activity in our regions and across the U.S. It's not near as intense as it was last winter, but it's an important level of activity. As more people have gotten vaccinated, instead of large spikes in activity, we tend to see a lower intensity of activity. We've, in a sense, flattened the curve with vaccination. I think can even flatten the curve further as more and more of us become vaccinated and receive our boosters.
Thank you. Let's go to Tom Lehman, WGAL TV in Lancaster. Tom, please go ahead.
Hi, I'm hoping you guys can hear me. What I wanted to ask, we're starting to see a lot of global response to Omicron right now. We've heard sort of varying degrees from doctors in South Africa about, how severe the illness is with the people who've contracted it. But we're seeing a pretty large global response with a lot of travel restrictions and other things being put into place. I'm just wondering, can you talk a little bit about how the research that's going to be happening about Omicron over the next few weeks is going to impact a lot of the decisions that are going to be made regarding how to handle this variant?
The advice that we give to our community is basically what Dr. McCreary, Dr. Yealy, and I have been talking about today, is important for keeping you well. And we'd like listeners and viewers to pair that advice up with what we get from our public health officials. The current public health guidance that you're hearing both in the United States and around the world is designed to keep our communities at large safe. This type of advice will evolve naturally as the variants spread and as we learn more about them. Our message today is for each one of you to think about your risk. It's important, again, to mask and distance to protect people from the spread of the virus. Vaccination is the most important way to prevent serious complications. And if you do feel sick, stay home, get tested, and talk to your doctor or give us a call about potential therapies, particularly monoclonal antibody. I don't think the emergence of a new variant, or I don't think as public health guidance waxes and wanes with the spread of the virus around the world that will change in any way.
Related to that, Dr. McCurry, Regeneron has said that their monoclonal antibody might not be as good against Omicron, but GSK says theirs works. What does UPMC plan to do to study this and provide some good answers?
Yes, so when new variants come out, all the companies that have monoclonal antibody therapies look at them in the lab, essentially, and they say, does this what we call neutralize the virus, meaning does the antibody work with the virus to prevent it from causing severe disease? And so all of the companies are looking at it right now, but at the end of the day, we don't know yet if Omicron is going to have an impact here. But what I can tell you is that we've been through this before. So what Dr. Snyder said and what we keep looking at, we went through this with Beta, and we went through this with Gamma, and we went through this with Delta, and we are more than prepared to pivot often the same day that this information comes out to change what monoclonal antibodies we offer to our patients, where they're offered, how they're administered, and we can pivot. We have such an amazing team and robust infrastructure that we do make these changes often within hours of hearing new emergency use authorizations or new information that may guide us. So we are more than ready to remove antibodies, add antibodies, and continue to use effective ones wherever.
Thank you, Dr. McCurry. Dr. Ewing?
One other thing I want to add is, of course, we'll follow the data that come from other countries, that come from the United States. But one of the advantages of being a world-class academic medical system and healthcare provider is that we can create our own new knowledge about new variants, about how they respond to therapies, how they spread in our populations. And that will allow us not only to guide your care and care in our communities, but to inform the rest of the country. That's what we shared today about monoclonal antibody therapy. So we will be looking for the variant. We'll be looking for how the variant interacts with us and how our therapies work. We'll know quickly, we will change quickly, and we'll share that information with you.
Thank you. Let's go to Paul Goff at the Pittsburgh Business Times. Paul, please go ahead.
Hi, thanks for taking the question and having the briefing. Right now, as you mentioned, it's very challenging for UPMC and all the other health systems. A typical winter's challenging, I think, pre-COVID with the flu through March or so, and this will be the first year with both COVID and a potentially difficult flu season. And then Omicron as well. My first question is what are you going to do to kind of manage that? Because if it's challenging now, the math would suggest that it could be more challenging in the next month or two. And then the second question I had is the mix of vaccinated and unvaccinated patients in the hospital right now, if that's changed at all lately.
Dr. Ewing.
We'll continue to do all the activities that we do today to make sure that we have the capability and capacity to meet the needs of everyone who's seeking healthcare. That means making sure that we retain our workforce, that we grow our workforce, and that we look at how we do everything, and that we're willing to change old-fashioned ways to make sure that we're as efficient and as effective as possible. We can't take our foot off the gas on this. We can't do that over the Christmas holiday. This will be a key season, as you noted. That, plus our ability to generate new knowledge about not only how to care for and how to understand the COVID-19 pandemic, but other forms of illness. One of the advantages of this pandemic is it forces us to think differently about healthcare. And what I can promise you, and what we're doing already, is rethinking everything about healthcare to see how we can do this better, more effective for you, and more efficient for everyone else. The real secret sauce is not giving up and staying focused on improving each day, each week, each month. That's what will get us through the winter season and move us forward.
Thank you. Holly Patterson at the Record Argus in Greenville sent in this question. During testing, is UPMC isolating the variant type, and is that important in reporting the number of patients? Is it possible that Omicron is already here and spreading across the country? Dr. Snyder?
Well, first of all, we don't know that we need to do something different if you have an infection due to Omicron or an infection due to Delta. And even if in the future we do learn that we need a different monoclonal antibody or a vaccine booster that's specific to Omicron, it's not available now. The tools that we have now are effective and are the tools that we have now, which is why we keep reemphasizing get vaccinated, get your booster, and consider treatment if you're diagnosed. Now, the clinical tests that your doctor may order to diagnose you with COVID-19 or the ones that you may get from the pharmacy to use at home do not distinguish the type of SARS-CoV-2 virus. So there is no clinical test right now to distinguish those two types of viruses. However, our public health colleagues and us here at UPMC do investigate a sample of the viruses to know whether or not it is Omicron has emerged. I suspect with one case already in the United States that either there is already some transmission in the United States or it will be here soon. But again, I want to emphasize that even if Omicron is here, the tools in the toolkit are effective and we should use them.
Thank you. Next question, Jamie Martinez, Spotlight PA. Jamie, please go ahead.
Hi, thanks for taking questions this morning. Following up on the earlier questions about emergency room and general hospital capacity, will UPMC consider scaling back elective procedures as was suggested early in the pandemic? If we're seeing high rates, it sounds like we might be coming back to similar conditions. And if not, what is your plan moving forward to compensate for these staffing and resource shortages?
It's an excellent question. Since the beginning of the pandemic, when there have been varying concerns about the ability to provide care for not only COVID-19 patients, but everyone else, the UPMC approach has been consistent, that that's a decision best made at the hospital and health system level with key interaction between the patient, the physician providers, and the rest of the healthcare team. We have been tailoring all of the inputs for healthcare, whether that be a surgical procedure, a scheduled other procedure, or any other type of healthcare, to make sure that we match the need for the patient, our capabilities, and the needs more broadly. We have been doing this. We've been doing it in a tailored fashion. We'll continue to do that. Nothing about the approach has changed at all. I think what you're asking, will the thresholds change? Of course they will, as demand changes and the type of illnesses and conditions change. We will continuously ask, are we doing the best for the most, and adapt and adopt to whatever needs to happen.
I'll follow up with that in that we are learning while doing so. Our subcutaneous data has huge implications in that more healthcare providers are available to administer these injections as opposed to IV. So by studying this and finding this result that it's as good as IV, we've now let healthcare systems across the globe know that they can use things like pharmacists and other resources rather than just relying on one particular set of healthcare workers with one set of skills. We've now creatively expanded available staff to administer life-saving therapies. So those are other efforts we put in place to handle some of this.
Thank you. And our final question comes from Mark Hiller at WBRE-TV and WYOU-TV in Scranton. Mark, please go ahead.
Thank you very much for taking this question. It might have already been addressed in part by Dr. Yealy, but it stems to what's happening in South Africa. Health officials reporting this morning that not only does the Omicron variant seem to be mild, but that it also seems to be reinfecting people who've already had COVID-19 or some variant of it. What is your takeaway from this, that the virus may be mild and that it seems to be reinfecting people who've had the virus?
Again, I have a lot of praise for our colleagues in South Africa for doing a spectacular job at identifying this new threat, studying it very quickly, and sharing that news with the world. There are several ways a variant could change how the disease, how the COVID-19 pandemic plays out. It could cause different disease. It could be more severe or less severe. It is promising that the early signal is that it could cause less severe disease, but we're going to need some confirmation of that more broadly to know that that's the case. It could also change how the virus is transmitted, and we don't really have a lot of information yet on whether it's transmitted from person to person more effectively or less effectively. I will say it is concerning how quickly it is spreading in South Africa, and so we'll be watching globally to see how quickly it spreads and whether or not it's more contagious. And then, of course, as we've been talking about, it's important to know whether or not our immune system remains well prepared or is less prepared, whether that be from natural infection or from vaccination. And it's important to know how effective our therapies are. Now, we recommend vaccination even if you've been previously infected. And the reason why is we have strong data, including from the CDC here in the United States, that vaccination improves your ability to respond to infection even if you've been previously infected. As this virus changes, and this variant is much different than the Delta variant, it's not at all surprising that it might, your immune system, your natural immune system, may not be able to recognize it and respond as well or as quickly as it would. So reinfection is not a surprise. It's something that's been happening throughout the pandemic, and it only serves to reinforce the value, I believe, of getting vaccinated, and if you're eligible, to get the booster.
Okay, thank you, doctors. And that concludes the time we have allotted for today. Thank you all for attending. In about 45 minutes, we will email media attendees a link to download high-definition footage of this entire press briefing, which we do encourage you to use in your news reports. Anybody with a follow-up question, please contact the UPMC Media Relations Department. And as always, please follow @UPMC News on Twitter for updates. Thank you very much.